Hello, welcome back to my channel once again. Please subscribe, like, and share. Yes, today I just want to share with you guys the plight of persons with disabilities during disasters and health
Tambara,
emergencies.
chair of the
Yes, so
blind
let's
people
see
here at
what the
Mondo
people will
Village.
say.
Here I am. I just want to explain more about the COVID-19 cases and some of the disasters which has affected us, we blind people, especially people with disabilities, especially blind people. Um, we faced a lot of challenges when the uh, disasters occurred uh, on that time when the COVID-19 was taking place in 2019 and in 2020. And in 2022, 2023, we had a case of uh, flood cyclone, which affect us in different ways in terms of collapse of our houses, and we had now uh, place for us to be saved as since the rain was raining since for 2 weeks, so it was difficult for us to get food. So the people with disabilities had a lot of challenges in terms of such cases, especially uh, flood cyclone and the 2019 cases. So to us, we blind people, we faced a lot of challenges, and we had nothing to do on that day. And I just want to thank some of the
Indeed, health emergencies and disasters bring about changes in services delivery in various public places, and these changes causes various challenges in access to services in persons with disabilities. Among others, access to information is the main pride encountered by the persons with disabilities. The information disseminated to the public is mostly print, audio, and videos in Malawi, which is not accessible to persons with blind, hearing impairment, and visual impairment. And what next? This makes it difficult for them to adapt to the situation or be involved in recovery processes.
but we are just hearing from different radios that um, there is a problem of red eye in the such a situation of which we are just hearing now that there is a case of uh, we are talking about. So we have never been even informed in any way because we are disabilities. But we just want to ask the, well wishers to intervene, like Fidoma and or even Malawi, the blind or visually impaired, Vihema. They should come and join us and give us information because we have nothing to do alone.
Access to services is yet another challenge faced by persons entitled, considering that persons with disabilities do already face challenges like long distances, inaccessible infrastructure, and poor communication with service providers. Disaster and healthy emergencies further complicates their situation.
An attempt to solve these problems, it is important that the government and all other stakeholders should make sure that they prioritize using Braille or teach the service providers tactile information, tactile language, so that they can ably communicate with the deaf blind, and so that the deaf blind and us, the visually impaired, can easily access any information on disasters or health emergencies.
In case of albinism, one would hardly access sunscreen lotion.
My name is Ian Desmond Simbota, and I am a member of the Association of Persons with Albinism in Malawi, APAM. Well, I just wanted to share some of the challenges that persons with albinism face when it comes to health emergencies as well as disasters. I'll start with the health emergencies. I'll just give one example of one moment that we went through with COVID-19. During the COVID-19, COVID was one of the biggest challenges that stopped everything from happening. And we were not allowed to move, going places because of the curfews and all that, which was necessary when it comes to fighting the COVID-19. But now became a challenge to persons with albinism because at the end of the day, with our weather, with our hot and strong sun in Africa, particularly in Malawi, uh, wearing long-sleeved clothes or protective gear alone could not adequately protect a person with albinism from sunburn. So one of the very important aspects is to have sunscreen lotion, which is 50 plus, that is accessed through the hospitals, where you have to travel from your place or from your homes to go to the hospitals so that you can have access, or you can get a bottle of sunscreen lotion. So it was a problem because you are not allowed to move, but at the same time you are afraid of one of the worst enemies to persons with albinism, which is skin cancer, because skin cancer is one of the biggest enemies that has claimed many lives of persons with albinism, apart from the attacks and the abductions or the killings of persons with albinism. So to prevent skin cancer, apart from the protective gear that is advised for us to use, the sunscreen lotion plays a very big role. So during COVID-19, it was challenging because the sun was still scorching, but at the end of the day, we need sunscreen lotion, but we couldn't access it. So most of the times, especially during the COVID-19, we registered many new cases, I should say new cancer cases among persons with albinism, because many of them operated without using sunscreen lotion. Many of them had to travel, many of them had to still do their farming activities, doing their businesses, household chores and all that without sunscreen lotion. Now there are some other areas where it goes beyond, you cannot fully protect yourself, like in the farming field. It became a challenge without sunscreen lotion.
As persons with disabilities, we've been facing different challenges right from the COVID-19 pandemic, as well as these other health emergencies. You're talking of cholera, you're talking of the pink eye, whatever it may be. Most of the times, as persons with disabilities, information hasn't been easy to come by, such that in most of the cases, we've been caught unawares. And our call to authorities is that these issues must not exclude persons with disabilities whenever interventions are coming, reaching out to the general public. Let's make sure that the information that is being provided is being provided in accessible formats. At the same time, the health system must be always prepared to make sure that persons with disabilities are being well catered for. You would imagine a situation that a person with a disability has actually that particular ailment. We just have to make sure that service providers, health service providers, are well capacitated to provide such kind of services. Issues of sign language interpretation must be in almost all the health facilities, and at the same time, those kind of disability inclusive approaches in terms of service delivery, so that a person with a disability even is having that kind of a health-seeking behavior. In so doing, it means that we're going to keep those kind of pandemics that may come at any other time. And even in other situations, whenever we have such kind of outbreaks or pandemics, let's make sure that those departments or sections that actually provide disability-related health services, it may be provision of mental health services, it may be provision of epilepsy drugs, be sunscreen lotion, those kind of services should not be disrupted in any way. We must make sure that the services are being provided continuously without any kind of disruption. In so doing, what it means is that we are allowing those persons with disabilities to remain fit, at the same time to remain productive in the society.